Hi, and welcome to another episode of Do Yourself No Harm, the podcast and YouTube series that helps busy and overwhelmed professionals and entrepreneurs to overcome burnout. I'm Dr. Claire Ashley. I'm a GP and burnout survivor and expert. I'm really pleased to announce that shortly, at the end of October, I will be launching my signature Beat Burnout Recovery course. This course encompasses everything that I have learned about burnout, and it's going to be a real deep dive into the causes of burnout, how to recognize it, how to sustain your recovery, and it's going to draw on my own personal experience with burnout, as well as my clinical experience as a doctor and my own academic experience as well. If you would like to be the first to know when the course is launched, please sign up to the waiting list using the link in the bio. So in today's episode, I'm going to be talking about compassion fatigue, moral injury, and burnout, and specifically how to deal with these things as well. With this podcast being talking about compassion fatigue and moral injury, I would say largely it's aimed at people in caring professions or people working in the public sector. So anyone that is currently in a job where you carry responsibility or you care for other people, where resources are tight and there are systemic pressures at play, you will be at risk of compassion fatigue, of moral injury, and of burnout as well. So let's talk a little bit about why I'm going to be talking about compassion fatigue and moral injury today. Now, last weekend, I went and did a shift in out of hours. So one of my roles is working as an out of hours GP. And I've done this for a long time, actually. So when I started my GP training back in 2014, I had to start working in the out of hours service as part of my training. So I've been working in the out of hours service now for, 8 years. I had to do a bit of maths there. Not my strong point, as you can tell. So yeah, I've been working both as a trainee and as a fully qualified GP in out of hours, and I really enjoy it. So my background as a medic is in acute and urgent care. So for me, it's really my comfort zone, and it's a sort of work that I get a lot of satisfaction from. However, the pandemic really has changed the way that we work. So pre-COVID, our clinics were incredibly busy. We saw a lot more patients face to face. But whilst the service was busy, we were always largely able to meet the demand and manage our patients safely and with care and compassion. However, like a lot of services in the NHS now, the out-of-hours service is struggling with lack of resource and huge patient demand. So last week I went and did a shift, and it was really, really busy, and we were short of doctors and nurses on that shift. And I think it's the first time ever that I've gone to work and my clinical decision making has been actively impacted by the lack of resource. So I had patients where I wanted them to have face-to-face assessments, and I wasn't able to arrange that for them because of the demands on the system at the time, and because we just did not have the capacity within the system to get these patients their face-to-face assessments. I don't think that has ever happened to me. And as a result of it, both during the shift and after the shift, I ended up thinking about this a lot, and it caused me quite a lot of distress. And it brought back a lot of the moral injury that I experienced with my burnout and with the circumstances around my burnout as well. And I think particularly at this present time as well, it's something that a lot of us in healthcare are experiencing. So, for instance, in my area, we had an email this week saying that our 2-week wait for colorectal cancers is now between 11 and 12 weeks. So for patients who come to us with symptoms suggestive or worrying us that they might have a colorectal cancer, whereas the gold standard guidelines say that they have to be seen and assessed within 2 weeks by secondary care, at the moment it's taking 3 months just from the GP doing the referral to the patient being seen. They haven't even had their investigations yet at that point. So that's just an example of how difficult it is in the system at the moment to get people seen and assessed. So that's for patients who should be seen within 2 weeks. That's not even touching on, patients who have ongoing concerns, who are, who need to be investigated or seen for more routine problems. The wait times for routine problems are so huge now. And unfortunately, that means that in primary care, for instance, we're having to manage patients with more complex and more embedded problems that really are outside of our own area of expertise and knowledge, but we're having to hold them. And this is distressing, both for the patient and for the doctors involved as well. But I think that there are other industries and sectors where there are similar pressures, and you can experience compassion fatigue and moral injury in those sectors as well. So I'm thinking particularly about anyone who is in the caring profession. Huge problems in the caring sector at the moment. I'm thinking also about teachers, social workers, anyone really that works within the public sector. Dentists as well really struggle, I think, particularly if they work in the NHS, with compassion fatigue and moral injury. So it's a huge topic, and I can't even start to scrape the surface of the problems that are within the NHS at the moment. But basically, we're working in a system where we have huge lack of resource at the moment, both in terms of human resource and physical resources as well. And the impact on how we experience our work is really significant. And there are several ways that this can kind of manifest. So I'm going to talk to begin with about compassion fatigue and what compassion fatigue is and how it differs slightly from moral injury and burnout. So compassion fatigue is described as a deep physical, emotional, and spiritual exhaustion accompanied by acute emotional pain as well. It's essentially trauma by proxy, and it happens when the healthcare professional or the care provider in any particular situation takes on the stress and the trauma of the things that are happening to their patients or the people that they are giving the care to. So, for instance, for myself, I'm at risk from compassion fatigue because our patients at the moment are really distressed. They are quite understandably upset that they find it difficult to access their GPs because we have huge problems with access at the moment in general practice. And they're also really distressed by the fact that they're struggling to access secondary care and be seen for their medical problems. And it's really hard to not take on that pain, and particularly so when it's not just the occasional interaction that you're having when you're coming across people who are that distressed. But at the moment, it's pretty much every interaction, and that's really hard to deal with. So when you experience this on a regular basis, it leaves you in a state of physical and mental exhaustion. And it means that you have a reduced ability to cope with your everyday environment and work stresses. Professionals that are regularly exposed to the traumatic experiences of the people that they serve are particularly susceptible to developing compassion fatigue, as I just described. And in healthcare, this can impact standards of patient care, relationships with colleagues, or lead to more serious mental health problems such as PTSD, anxiety, depression, or burnout. In the short term, it might cause exhaustion, anger, irritability, negative coping behaviors such as alcohol and drug abuse, a reduced ability to feel sympathy and empathy, a diminished sense of enjoyment or satisfaction with your work, increased absenteeism, and an impaired ability to make decisions and care for patients. So compassion fatigue has really quite significant implications. Now, where this differs from burnout is that in compassion fatigue, instead of becoming less empathetic and withdrawing from your patients and withdrawing from your work and having that detachment, which is very, very pathognomonic of burnout, instead, compassion fatigued healthcare workers continue to give themselves fully to their patients, and they find it really difficult to maintain a healthy balance of empathy and objectivity. So how that might manifest itself is it's basically the age-old medic thing of thinking, well, if there's a problem, all I have to do is work harder and I can fix those problems, which unfortunately in this current situation isn't an answer to the deeply embedded problems that we have within the NHS. But for instance, a compassion fatigue doctor or nurse, for instance, might try to manage their compassion fatigue by trying to rectify the problem and help their patients more. So it's driven by empathy, it's driven by compassion, it's driven by caring for your work. And basically what it means is you start doing things like working longer hours, trying to spend more time with your patients, actively, going the extra mile for them, which is something to be admired in, obviously, when it's working well and you're working within a system where you can do that. But unfortunately, at the moment, we're not working in a system where actually spending longer with your patients or working longer hours is actually going to do anything to alleviate your symptoms of compassion fatigue. I read a really interesting paper on compassion fatigue, and this is how they described it. I think this is a really provocative and impactful statement. Those who have experienced compassion fatigue describe it as being sucked into a vortex that pulls them slowly downwards. They have no idea how to stop the downward spiral, so they do what they have done since medical school. They work harder and continue to give to others until they're completely tapped out. For me, that just speaks to me on every level. I totally identify with that. And I don't think that this is a phenomenon that is unique to medics either. I think that other people, particularly in caring professions, can experience this. So to those that are in the throes of compassion fatigue, time, or more precisely the lack of it, is the enemy. So to compensate, you might, as I said before, start working longer hours. You might try to do several things at once. You might, for instance, eat your lunch whilst, trying to sort out your paperwork, returning phone calls, trying to multitask, basically take too much on. And when you end up doing that, it means that there is less time to do the things that can sustain or recover you from your distress, such as, for instance, regular exercise, doing things that you enjoy outside of medicine, having time to eat and have a relaxed, enjoyable meal, time with your family and friends, prayer, meditation. But it doesn't matter how much or how well you sleep, for instance, you still wake up exhausted. The good news is that you can recover from compassion fatigue. It's something that I think that can be a precursor to burnout, but it's not the full burnout syndrome. So you can recover from it. You absolutely have to look after yourself and learn to care for yourself, really, in order to deal with the compassion fatigue. So it might, for instance, involve a short period of time off work or seeing a counsellor or a therapist. I also think that getting peer support when you're working in difficult systems is really, really important. It's also a protective factor against you burning out as well. And also, if you are burnt out, peer support is also really, really good at forming part of your recovery process as well. The only thing is that the group has to be a safe space for you to offload. So as long as you have that, make the most of that. And self-reflection is also a really good way to combat compassion fatigue. So you can use self-reflection to identify what's important to you and to live in a way that reflects that. And then once you've defined and identified your values, you need to work within them in order to sustain yourself at work. And I'm going to come on to talk a little bit more about that after I've spoken about moral injury. So let's talk a little bit about moral injury and moral distress now. So the term moral injury was first used in the First World War by a chaplain who coined it to describe some soldiers' responses to their actions in the war. So moral injury is perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. Now, obviously, that was said in the context of war, and you can well imagine the acts of war that these soldiers had to go through and had to do against their own ethical codes. In healthcare and outside of war situations, moral injury takes on a slightly different meaning. It's basically the consequence of being unable to provide high quality care for our patients despite our deepest and best intentions and due to factors that we cannot control. So I think that moral distress and moral injury are kind of a different way of conceptualizing how burnout can occur and how compassion fatigue can occur. It describes the concept of being put in situations of unsustainable pressure, inadequate resources, a sense of wanting to do the right thing and not being able to. Now, in burnout, the symptoms that you get with burnout include exhaustion, cynicism, and decreased productivity. But it doesn't, I think when it comes to moral injury, it doesn't quite fit that definition. And I think that the thing to remember about moral injury as well is it's not the consequence of the individual. It's not because they're not resourceful enough or resilient enough. It's because of the lack of resource in the system that pushes you to experience this moral injury. And what's really interesting about moral injury is that alongside compassion fatigue as well, work has shown that failing to consistently meet the needs of our patients has a profound effect on our well-being. And so moral injury is a significant risk factor for burnout, other mental health problems, and needing time off work as well. And what you end up is being caught between kind of the principles of the Hippocratic Oath if you take it. I didn't take the full Hippocratic Oath when I graduated. I did a modified version, but basically we work under the Hippocratic Oath and the principles of it in order to deliver good care to our patients. So we end up getting caught between the principles of that oath and the reality of dealing with complex patients at their most vulnerable with very little resource, as I was last weekend. Now, routinely experiencing this, perhaps once or twice, every now and then, you can recover from that. But when they become incessant every day, when you're going to work and you're just firefighting the whole time, it feels like these miniature betrayals of patient trust and patient care end up becoming routine, and it becomes death by 1,000 cuts. When you're experiencing lack of resource on a daily basis, when you can't deliver the care that you want to because of the lack of resource, that is when you start to experience moral injury. And let's face it, we are very, very dedicated professionals. If we could work harder, smarter, or differently to address this problem, then we would, and we can't. And that's the whole point about moral injury. It's not down to any individual failing. So let's talk a little bit about how you can deal with moral injury then. So I think in terms of dealing with it, again, it's similar to how you might deal with compassion fatigue, which is to take some time to think and to self-reflect about what you want to do with your career and whether or not how you're working is in alignment with your values. The way I recommend that people do this is through ACT, which is acceptance and commitment therapy. Now, I've had quite a lot of ACT done with my therapist that I had during my burnout experience. I also had CBT, but I found that ACT was really good at allowing me to manage the stresses that I couldn't control, for instance, like the lack of resource in the NHS, and giving me strategies to try to manage it. And what ACT does is it tries to get you to sit with uncomfortable emotions and uncomfortable feelings and to not react negatively to them, and to learn to meet those difficult challenges without feeling distressed. And it's really hard to do that, and it takes time to perfect the techniques. One of my favorite techniques is diffusion, and I'm just going to very quickly explain what diffusion is now. But if you'd like to know more, I recommend that you go and read The Happiness Trap by Russ Harris. So Russ Harris is a former GP. He's now an ACT therapist. He came up with ACT, and he's written a book on it, and it's got loads and loads of information in there about what ACT is, how to fit it into your life, what techniques to use, and I really, really recommend that you go read it if you'd like to know more. So diffusion is taking a thought that is distressing you. Let's say, for instance, in the context of moral injury, it's a thought about feeling really upset and distressed that you can't deliver the care that you want to for your patients. You take that thought and you play around with it. So you experience the thought, I am feeling upset that I cannot deliver the care I want to for my patients. And you just say it over and over in your head for a couple of minutes and just see how you feel in your body and in your mind. Then you start to play around with what you're saying to yourself. So you might say to yourself, after you've done the initial bit, I am observing that I am upset that I cannot give the care that I want to my patients. And then you just repeat that sentence over and over with the I am observing bit in front of it. Then, after a couple of minutes, once you've observed how you're now feeling, you then change the sentence that you're repeating over in your head again. So this time it might be, I am thinking that I am observing that I am upset about, etc., etc. And then you just repeat this over and over in your head until you get to a point where you're no longer experiencing the emotion that goes alongside with that thought. Now, it does take time to perfect this technique. It's not something that you can do every now and then and expect it to make a difference. It's a bit like physio for your brain. You have to practice it regularly to become good at it and for it to have a significant effect on how you feel. But for me, that has been my favorite technique that I've learned out of my entire therapy journey, because it's made such a difference in learning to different strategies and learning how to cope with stresses that I cannot control. And when it comes in particular to moral injury, I think the ACT is a really, really nice way of trying to manage those emotions and your response to that stressor. So that's diffusion. But what I also really like about ACT is that not only does it teach you ways to manage those negative emotions and not to try to respond to them with too much emotion, it also then, the second part of ACT is to work out your values and then to make decisions and to move forward with your career based on your values, and it basically encourages you to engage with values-based decision making. So it's really good at moving you on as well. And for that reason, I think it's the perfect way to try to at least start to manage some of the moral injury and the moral distress that you might be experiencing at the moment, and particularly bearing in mind that as individuals, it's very, very hard to try to manage the systemic pressures that we're under. So I hope that that's been helpful. As always, if you've enjoyed this episode, please hit like and subscribe, and I will see you guys again soon. You take care.